All right, let's talk about something that's, well, it's really tough. We're diving into teen substance use. And look, if you're watching this, chances are you're feeling worried, maybe even a little scared. I just want you to know that's completely normal and you are definitely not alone. The fact that you're here looking for answers, that's a huge positive first step. So let's get into it.
And that really just hits the nail on the head, doesn't it? Finding this out, it's one of those moments that just takes your breath away. It's so easy to fall into a spiral of shame or blame, but listen, that's not going to help anyone. The simple fact that you're here, right now, trying to learn, that shows how much you care. And that care, that is your superpower in this situation. It's the most powerful tool you've got. So to really tackle this, we have to start with the why. I know it's tempting to just jump to conclusions and think it's about making bad choices, but honestly, it's almost never that simple. The reasons teens use substances are way more complex than you might think.
Okay, let's get into a little bit of the science here because it's actually fascinating. A teenager's brain is literally a construction zone. And this part right here, the prefrontal cortex, think of it like the CEO of the brain. You know, the part that makes good decisions and controls impulses? Well, in a teen, that CEO hasn't quite finished their training yet. It's not fully online. And because of that, they are biologically wired to be more drawn to risk-taking. It's not an excuse for sure, but it is super important context to have.
And it's not just about brain chemistry, right? There are so many other things going on. Sometimes, yeah, it's just plain old curiosity. Or that really intense pressure to fit in and be accepted by their friends. But for a lot of kids, it's a way to cope. A way to deal with stress or anxiety or depression. They're basically trying to self-medicate for these huge feelings that they might not even know how to talk about yet.
Okay, so how do you even know if there's a problem? This is the tricky part because, let's be real, typical teen behavior is already a wild ride, right? Mood swings, sleeping in, it's a lot. The real key here is to look for a pattern. We're not talking about one bad day or one weird comment. We're looking for a collection of changes that just don't feel right.
It also helps to know what we're even talking about. What are the most common things kids are using? Well, alcohol is still number one. But today's marijuana, it is so much more potent than what you might remember. Vaping is everywhere, and a lot of teens have no idea they're getting hooked on highly addictive nicotine. And then there's a really big one, prescription drugs. Often they're just grabbing them from a medicine cabinet at home.
Okay, I need you to really hear this. This is probably the most important thing we'll talk about. The world of drugs has completely changed. There's something called fentanyl, a ridiculously powerful and deadly opioid, and it's being mixed into everything. It's being pressed into fake pills that look exactly like Xanax or Adderall, so your kid might think they're taking one little pill from a friend, and it could be the last thing they ever do. The danger is that real. One pill can kill, period.
So where are you going to see these warning signs? They usually show up in four main areas of a teen's life: their behavior, their physical appearance and health, their mood and mental state, and what's going on at school and with their friends.
Let's zoom in on behavior, because that's often where you see the first signs. Ask yourself, are they suddenly super secretive or lying a lot? Did they drop all their old friends for a completely new group? Are they avoiding family stuff they used to enjoy? Are their grades tanking? And of course, finding things like pipes, little baggies, or even a ton of eye drops, that's a huge red flag. Remember, you're looking for a bunch of these things happening together.
And all of this leads back to maybe the most important tool you have in your toolbox, your gut, your instinct. You know your kid better than anyone on this planet. If you have that little voice in your head saying, something's not right here, listen to it. Don't brush it off. Your intuition is real, it's powerful, and you need to trust it.
All right, so you've seen some signs, your gut is screaming at you that something's wrong. Now what do you do? This next part is all about how you talk to them. And honestly, the way you start this conversation can be the difference between a total shutdown and an actual breakthrough.
So let's look at some examples of what to do and what not to do. Your goal here is to open a door, not slam it shut. So instead of saying, I know you're using drugs, which is an accusation, try something like, I've noticed some changes and I'm concerned. Instead of, you're making terrible decisions, which is just shaming, try, I'm worried about you because I love you. You want to be listening, not lecturing, asking open-ended questions, not starting a fight.
This is the single most important rule of all. This is not about winning an argument. This is about preserving your relationship and keeping your child safe. Your whole goal is to keep the conversation going. You want them to know that no matter what, they can still come to you, even when they've messed up, especially when they've messed up.
Okay, once you've opened that door and started talking, it's time to take action. Having a plan is going to help you feel less panicked and more in control. So let's break it down. What do you need to do right now, and what are the next steps?
Here's your immediate to-do list. Number 1, and this is non-negotiable, safety first. If your teen is intoxicated, passed out, or in any kind of distress, you call for emergency help, immediately, no hesitation. Number 2, do your absolute best to stay calm. I know it's hard, but your support is going to do so much more than your anger right now. 3, go through your house and remove access. Lock up medications, get rid of any alcohol, clear out anything you found. And 4, pick up the phone and call a professional. A doctor, a therapist, an addiction specialist. You are not supposed to figure this out on your own.
And when you start looking for that professional help, just know that there are options. It's not a one-size-fits-all thing. For some kids, weekly therapy is enough. Others might need a more intensive outpatient program, or, in more serious cases, residential treatment. The right professional will help you figure out exactly what your child and your family need.
Here's something else that is so important to hold on to. Recovery is a journey, not a straight line. There are going to be bumps in the road. A relapse can feel like a total failure, but it's not. It is not a moral failing. It just means the recovery plan needs a tune-up. It's a sign to re-engage, offer more support, and get back on track together.
I know we have gone through a lot of really heavy stuff, but if you take away just one thing, let it be this. It all comes down to connection. Having a strong, loving relationship with you is the best protection your child can have. So I want to leave you with this question. Just for a second, put all the big scary stuff aside. What is one small thing you can do today to connect with your teen? Maybe it's just watching a dumb show with them, or asking about a song they like, or even just sitting in the same room for 5 minutes without your phone. That connection, that's everything. That's your foundation. Start there.